So, thank you guys for coming. We're going to go ahead and get started. This is a part of our series with the partnership with the Valley Mountain Regional Center and the University of the Pacific Thomas J. Long School of Pharmacy, where we are doing some educational series. We've done 2 of them where the VMRC has taught us some important information, and this is our 4th of the series where we are teaching consumers some information. And today we're going to be talking about really illnesses such as skin infections and things like that, just very briefly, as well as respiratory illnesses. So how to use your inhaler correctly, how to know when to go to the doctor, things like that. So we'll go ahead and get started. I've got 3 second-year pharmacy students here right now. We might be joined by a first-year pharmacy student as well if she's able to make it. She's in class, but if she can come as well. Did the 3 of you guys want to introduce yourselves?
Hi, I'm Sydney.
Hi, I'm Muna.
And she's Christy.
Yeah.
I can give you my computer. Yeah, so Christy will probably have to slide over and use my computer. We're sitting in a room together, so we're being very creative. So feel free to stop us at any point if you have questions, but otherwise we'll go ahead and get started.
Okay, I'll start off with what is a skin infection. A skin infection is when germs get into your skin and make it red, swollen, hot, and painful. Germs can enter your skin when you get a cut or scrap, get a bug bite, scratch too hard, or don't clean a wound. So what do skin infections look like? They can look like an abscess, which is a bump. It looks like a red lump full of pus. It can be warm and painful, may pop or drain yellow stuff, and can also look like foot infections in diseases. You can see on the bottom right, redness or pain in your foot, open sores that don't heal, swelling or bad smell, and it can also look like cellulitis, which is skin swelling on the top right, and that is skin looks red, puffy, and warm, feels sore, and often on legs or arms. So how do you prevent a skin infection? You can clean your skin, wash daily with soap and water, keep cuts clean and covered. Don't share your personal items, so no sharing of razors, towels, or socks. Take care of your feet. If you have diabetes, check your feet every day. Wear shoes that fit you very well, and tell someone if you see a bump, sore, or redness. How are skin infections treated? You may need some medicines, such as antibiotics. It can come in a cream or a pill. Sometimes a doctor will drain the pus for you. You can also go to the clinic or the hospital if it gets worse. For foot wounds, keep pressure off the sore, no walking barefoot, and see a foot doctor if you have diabetes. How do you prevent diabetic foot infections? From the little pictogram, you can see tips for having a healthy feet. Just check your feet every day for the cuts, redness, sores, blisters, corns, or calluses, sorry. And then wash your feet every day in warm, not hot water, and dry them very well. Never go barefoot. Wear shoes that fit you well, and always wear socks. Trim your toenails straight across. Don't try to remove corns or calluses yourself, and get your feet checked at every healthcare visit.
So one thing I actually want to add to this as well, if you are someone who has diabetes or even pre-diabetes, but if you have that diagnosis, your insurance will actually pay for you to be able to see a podiatrist to get your feet looked at, and the shoes as well that she's talking about. It's very important that you have shoes that fit well. Most shoes that we like are super cute, but they're really, really not comfortable, and they have kind of these pressure places, and it can be really damaging. You want to mute yourself? It can be really damaging for the patient long term. It can cause sores and all kinds of issues as you move on. So your insurance will actually cover for you to be able to see a podiatrist, as well as getting actually specific shoes, some footwear that is safe and is actually fitted to you. Same with socks. If you have to have compression socks or something along those lines, you actually can go through your insurance to get those not only covered, but fitted. You can purchase them yourself, but having the right fit, the right strength, everything like that with compression stockings and things like that makes a huge difference. And it's important to go to a podiatrist for these things because you might not understand, you may not see certain cuts or nicks or things in your feet. Those calluses may just look like something normal, but if you have a cut in there underneath and you have diabetes, that usually means you have poor circulation in your feet. That can really cause major problems and lead to infections that you may not be able to see. So what she's going through here are just ways that most people don't think about. They don't think about trimming their toenails straight across. They think maybe for comfort, but it also can cause an infection if you don't cut them straight across. So these are some really helpful ways to prevent you having any issues later on down the road.
So what are fungal infections? Fungal infections are caused by dermatophytes. These can affect your skin, hair, nails by breaking down the outer layer of your tough protective protein, your keratin of your skin. So what does fungal infections look like? They can look like an athlete's foot, which happens between the skin, which is the skin between your toes becoming red, cracked, or itchy. You use antifungal creams available over the counter or by prescription. So under the lower left, you can see the two images of how an athlete's foot would look like. And for the ringworms, it's not a worm, it's a fungi, and it appears as a red ring-shaped rashes on your skin and can be also treated with antifungal creams.
Another thing I actually wanted to add on here, and this is just kind of from experience. I've had a lot of people over the years, they don't think that athlete's foot's a big deal, and it shouldn't be. If you catch it very early, it's very easy to treat. But a lot of people I talk to think that just kind of peeling that skin that is kind of cracked and gross looking, they peel that and they think that that's good because it looks better. It actually is very damaging because you're just making layers and digging basically a hole. So yes, sometimes you get lucky and it can clear on itself, but fungal infections, both of these versions can be very hard to treat. And she'll be talking about toenail fungus in a second. Fungal infections can be very difficult to treat. So there are over-the-counter options, but if you notice it's not going away, you may have to go to the doctor for medications. You may have to take it for a very long time. Like some of those, like the fungal infections in the toenails they're a nightmare. So do make sure, they're very common, you know, athlete's foot is very common, but do make sure that you're paying attention and going to the doctor when you need to.
So the next two examples of how a fungal infection will look like will be jock infection. Itch is red itchy rash in your groin area. You also treat that with topical antifungals. And then for the toenails that Dr. Ransom mentioned from the previous slide, they do look like they're not very, you need medical attention on those kind of fungal infections. Also the ringworms of the scalp, you need prescription medication. So you actually need to go to a doctor to get treatments for these kind of infections. So how do I prevent a fungal infection? Prevention, first, you keep affected area clean and dry. Avoid sharing towels, shoes, or nail tools. Apply medications as directed and talk to your doctor if the infection doesn't improve. Staying on track with treatment. Choose a treatment that wouldn't get in the way of your daily routine. And make sure to finish the full treatment even if you start feeling better earlier. Stopping too soon can let the infection come back. And these are the over-the-counter treatments for fungal infections. Some of them come as cream, some of them come as sprays. Yeah.
Okay, and now we're gonna switch over to kind of asthma, how to manage it, as well as COPD, chronic obstructive pulmonary disease, some triggers, as well as kind of inhalation administration techniques as well. So right here, I have some of the symptoms you might notice if you do have asthma or someone you know has asthma. You don't have to have all of these symptoms, but the more symptoms that you have, you could attribute these symptoms could be due to asthma. Some kind of mainstay symptoms that you might notice is shortness of breath, some pressure on your chest, like tightness on your chest, as well as kind of like wheezing when you're breathing. Like when you're breathing out, you hear a kind of like whistling sound. And some people may notice also coughing and sneezing, runny nose. And these symptoms, they vary in severity. They're not always bad, they're not always good. It could be seasonal, it could be worse in the morning, early in the morning, or worse at night. It really just depends person to person. So right here, I have listed some triggers that could cause some asthma flare-ups for people. It just depends person to person, like I said earlier. And it's really important that you identify what triggers cause your asthma to be worse so that you can remove these from your environment. For instance, we have some people may commonly know pollen could make asthma worse. So it could be like seasonal with cold air as well. And then also dust can make asthma worse. So I do see some people, they may, have to clean their environment more often or change their environment from, like carpet floor to hardwood floor. Some people may be triggered by pets, some certain pets getting too close to them. Something that some people may not know is strong smells can also trigger asthma. So like, I know perfume, everyone wants to smell good, but it could also trigger someone's asthma. And then also another thing that could trigger asthma is like your emotions as well. Feeling really angry, really stressed could trigger the asthma. So it's really important that you try to regulate your emotion as much as possible. And some of the things are like chemical smells, pollution, bugs in the house, fungus and mold. It really just depends. So here I have some questions that a doctor may ask you to try to see if your asthma is under control. These questions are going to try to see your symptoms over the past month. They're going to see, hey, did you have any breathing problems during the day more than twice a week? And then do you have any nighttime symptoms because of your asthma, making it hard for you to breathe? Are you using your quick relief inhaler more than 2 times a week, a rescue inhaler? And also, is your asthma causing physical limitations for you, causing it hard for you to be able to walk, to go outside, play, even go up the stairs? So with these symptom questions, it's really important that you are actually adherent to your medications as well. Because let's say your doctor asks these questions about your symptoms, and you're not even adherent to your medications, your doctor may give you more medication, prescribe more medication than you need, just because they might be under the wrong impression that you are adherent to your medications. And it's really also important to be adherent to your medications because it will reduce the risk of asthma flare-ups, hospitalizations, and such. So here are, so this is kind of coincide with the next slide I'm going to show you guys. But there's for when you have any asthma flare-ups, there's an asthma action plan that your doctor will go over with you and create for you. And there's going to be 3 different zones. A green zone that goes over like your regular treatment every day that your asthma is maintained, well controlled. A yellow zone where you're experiencing some symptoms and what to do, as well as a red zone, some your emergency state kind of where you need to seek immediate medical attention. So going into the next slide. So here is your asthma action plan. Like I said, your doctor should create this for you and with you, and this should be reviewed every year, at least once every year as well. So the first part is going to be that green zone. It's going to go over regular treatments that you receive every day. Right here, we have the example Symbicort, as well as with your maintenance treatment, you also have your rescue inhaler, right here, your reliever. And then it also gives you some symptoms to watch out for to see if you are in the green zone. It says you can take part in normal physical activity and you're not having any daytime or nighttime symptoms as well. In the middle part is going to be that yellow zone. You're noticing some symptoms over a period of 2 days. It's going to go over what you should do if you notice that. You see these like 3 check boxes right here. Your doctor will figure that out with you. And then it will go over, hey, this is a sign that you should also seek medical attention if you're taking too many puffs of this. That third zone is going to be that red zone where you should seek medical attention. Your symptoms are getting worse. You're finding it hard to breathe, even to the point where you're having trouble speaking, like full sentences, even just speaking only words. You should call 911. In this space on the right, you're going to see some steps to take, like staying calm, taking one inhalation of your Symbicort, waiting 1 to 3 minutes in between, or also taking albuterol if that's your relief treatment. You have like your prednisolone tablets, and then also it has a little mention right there on the bottom saying even if your symptoms appear to settle, you should still see your doctor immediately after. And then here we have some ways to manage your asthma without medication. Like I mentioned, those triggers earlier, staying away from those triggers and learning how to use your inhaler the right way. Later on during this presentation, we're going to go into correct inhaler administration techniques, know when to use it, which your doctor should also go through with you, taking care of your other comorbidities like diabetes, high blood pressure, because that could possibly lead to more asthma flare-ups, make your asthma a little bit harder to manage. Not smoking, moving your body, eating healthily, and also just talking to someone or taking deep breaths to help with stress when you're stressed or feeling upset. Because like I mentioned earlier, your emotions, like when you're feeling very angry or stressed, could also be a trigger. And then we're also going to go over some vaccines that you should get when you do have asthma, like the pneumonia vaccine and flu vaccine that we have on the bottom, because those can affect your respiratory tract system.
So now we're going to move on to COPD, or chronic obstructive pulmonary disease. So this is a more long-term lung disease that makes it hard to breathe. If you have COPD, you'll notice that you'll be coughing, wheezing, having trouble breathing, and also having a lot of mucus. And COPD happens because our airways and our air sacs in the lungs are damaged. So it's just having trouble getting the air out. And then COPD usually gets worse over time and it doesn't really go away. Some things that can cause COPD is genetic, so things that we can't really change, things that we're born with. But it can also happen because of long-term exposure to the things around us that are harmful, like smoke, pollution, or dust in the air. And these things will slowly hurt our lungs over many years. How do you know if someone has COPD? Some signs or symptoms would include having trouble breathing, especially when walking or being active, wheezing that will happen again and again and doesn't really go away, coughing a lot or coughing up mucus, and also getting frequent lung infections, so being more susceptible to pneumonia or bronchitis. There are some ways to help COPD without medicine, so that includes avoiding triggers or things that would make it worse. So staying away from tobacco smoke and obviously not smoking yourself. Avoiding going outside if you know there's a lot of pollutants in the air or a fire nearby, and also trying to protect yourself from respiratory infections, which includes getting the flu vaccine every year and also the pneumonia vaccine. And then also maintaining a healthy lifestyle just to improve your overall health, including eating a balanced diet, exercising regularly, and making sure to get enough sleep.
And just really quick, when she's talking about some of the air pollutants and things, this is actually what they talk about when they're talking the air forecast and the safety, and they say they recommend that you stay indoors or that some certain people stay indoors. This is usually the group, those who have asthma, but especially COPD, because it'll make those conditions worse. So just for some context, when you see that, that's what this means.
And then if you notice that you're having a COPD attack or flare-up, some things you can do are using your short-acting bronchodilator or medication, normally albuterol for most people, using it as prescribed to just help improve your breathing. And then also monitoring your symptoms closely. If you do notice that your shortness of breath isn't improving or it's getting worse, you also have a high fever, chest pain, swelling in your legs, or any confusion or difficulty concentrating, that's when you're going to want to seek immediate medical attention. And if you're still, similarly, if the symptoms are just not improving or getting worse, or you're really having trouble breathing, then that's when it's time to call 911 or head to your nearest emergency department. And then generally just some differences to separate asthma and COPD. Asthma will have reversible symptoms, so medications can help those symptoms. Asthma is triggered by allergens in the air, cold air, and smoke, and along with other things that Sydney mentioned. And asthma can affect all ages. Normally, people with asthma will notice that it starts in childhood. Compared to COPD, COPD is irreversible lung damage, meaning it's progressive and it doesn't really get better. It's caused by more long-term exposure to smoking or pollution, and it's more common in adults older than 40 years old.
Okay, and then now we're gonna go into some of the administration techniques for the inhalers that you'll find in asthma and COPD, as well as some vaccines. So the first inhaler that you may possibly see, it's pretty common, is a metered dose inhaler. Some of your prevention inhalers, the maintenance inhalers, as well as your rescue inhalers may use a metered dose inhaler. And this is the actually only kind of inhaler that you can use a spacer or a spacer with a mask on. So when you use a metered dose inhaler, you're gonna, of course, remove the cap, and then you're gonna give it, every time you use it, you're gonna give it a good shake for at least 10 seconds. And then you're gonna prime it. And how you prime it is that you're gonna go ahead and press down, press out a mist at least 2 to 4 times possibly. And you don't have to do this every time. You just do it for the first time and every time you haven't used it, as in like if you haven't used it for more than a week, sorry about that. So first time when it's new, and then if you haven't used it for more than a week. And then if you are using it with a spacer, you can go ahead and attach it onto that mouthpiece right there. And then before you're using that inhaler, make sure that you're taking an exhale out. And then after you take a long exhale out, you're gonna go ahead and put your mouth over the mouthpiece, and then, or over the, if you're using with the mask, you don't have to do that as well. You're gonna have the mask over your nose and your mouth. And then you're gonna press down on the inhaler. And then while you press down, you're gonna inhale slowly and deeply. After you do that inhalation, you can of course remove the inhaler and then hold in your breath for at least 10 seconds, just to make sure that your medication can do its magic. And then after that, you take an exhale away from that device. And then if you do need to take another dose, you wait a minute and then you can take your next dose. If you are using inhaler with corticosteroids in there as well, you have to make sure that you rinse your mouth after. You may notice that with, for instance, like Symbicort, because if you don't do that, you might get oral thrush, kind of like a creamy white you see like in the back of your tongue, like the roof, or also your throat. So it's really important that you do that. And then when you do storage it, keep it in a dry, cool space. And the next inhaler that you could find is a dried powder inhaler. So with this dried powder inhaler, there is, you see there's like on the top right photo, there's like a lever that you have to push. So when you are like putting like the dose in, like you have to like also load it up with the lever. And then there's another part where you open it afterwards. And then for this one, you are going to go ahead, do that exhale away from the device. You seal your mouth over the mouthpiece, and you hold it like a hamburger. And then you could tilt your head like slightly back, but you're gonna go ahead, instead of doing like a slow and deep breath, this one's actually gonna be more quick and deep. It's gonna be like, yeah, I was not breathing out, but breathe in, of course. And then after that, you do the same like as the others. You hold for 10 seconds and exhale away from the device, waiting a minute for another dose, and then also cleaning, rinsing your mouth if it's like a corticosteroid containing one, which a lot of them do have also. And then, if you find yourself having trouble with that dried powder inhaler, let your provider know, because there are other options out there, like the one I mentioned earlier, the meter dose inhaler with the spacer, or even like the spacer with the mask if the spacer's too hard. And then you keep this one in a cool, dry place as well. Going into the next one, this is a Respimat inhaler. You do have to prime this one too, but you just prime it for like that first time. And how you prime it, we have the directions. You're gonna twist it, open it, and then press it about 3 times until you see a mist. You're gonna do that same exhale away from your device, seal your mouth over the mouthpiece, and then inhale steadily and deeply. So not a sharp one like the one I just mentioned, but more like a, yeah. And then after that, you hold your breath for 10 seconds and exhale away from the device. and then waiting another minute for that next dose, like I mentioned. It's really important, like if you notice for all three of the inhaler techniques, like there's like a exhale and then holding your breath. The exhale and the exhale is to make sure that you're like kind of like clearing out all your breath so that when you do take that inhale in from your inhaler, it goes to the right areas that the medication is supposed to work at. And also like holding your breath for 10 seconds, allowing the medication to, work its magic as well.
And then this slide is going to help kind of differentiate symptoms that you might have if you're having some type of respiratory symptoms, but you're not sure if it's flu, pneumonia, or COVID. So with the flu, you'll notice more symptoms that are like chills, aches, sore throat, runny nose, sneezing, watery eyes, and even sometimes loss of appetite. That's normally more with flu, but it can also be COVID sometimes. If you experience loss of taste or smell, normally that's COVID. And then chest pain normally comes with pneumonia. And then for the vaccines, these are important vaccines to get if you have asthma or COPD, just to protect yourself from other respiratory conditions that might make you more susceptible. So flu is important to get every year, normally in the fall. And if you're older than 65 years old, you'll need a high dose flu vaccine, which your pharmacist will be sure to give you just to give that extra protection. For pneumonia, it's important to get this vaccine to prevent yourself from getting pneumonia and also having severe complications from it. People who get pneumonia vaccines are the people who are younger or older or in the middle ages if they're medically fragile. And there are multiple pneumonia vaccines available. They're always changing and coming out with new ones. So it's important to ask your doctor or pharmacist which one is right for you and if you're eligible to get it. For the COVID vaccine, important to get to prevent you from getting COVID or also having severe complications if you did get it. And this one comes out about every year or whenever they release a new one. For the RSV vaccine, this is going to protect you from a respiratory virus. People who get the RSV vaccine are normally our kids, people who are pregnant, and also older adults older than 75 years old. But if you're within the age range of 60 to 74, you can also get the RSV vaccine if you're at a higher risk for getting severe RSV. So that's something that you'd want to ask your doctor or pharmacist about. For the Tdap vaccine, Tdap stands for tetanus, diphtheria, and pertussis, also known as whooping cough. So everyone gets this vaccine every 10 years. If you're pregnant, you want to get it with each pregnancy. And also people will get this vaccine when exposed to rust. So if you like stepped on a nail or had some type of other wound, we normally will give that vaccine just in case. And pertussis or whooping cough, it's very dangerous to people who are either really old or really young. So it's important for people in the middle ages to be getting that vaccine just to give extra protection, since you can have whooping cough with no symptoms or just be like a carrier without symptoms. So it's important that we're getting that one every 10 years.
And some additional things about vaccines, I think that is confusing for people is, you get the COVID vaccine and then you get COVID. And so you wonder, should I even gotten the vaccine? What flu, COVID, even pneumo, all these vaccines are trying to do is to prevent you from getting it. And if you do get it, hopefully you won't get those severe complications or hopefully not die from it. The problem with COVID when it first came out is we had nothing for it. And so when people got it, it took them down hard. So these vaccines are aiming at trying to decrease the severity if you do end up getting it. None of these vaccines are considered live vaccines, meaning that all of the vaccine itself is dead. So you can't get the infection from the vaccine itself. What happens is that it just maybe that flu vaccine that year, the flu you caught, just wasn't one of those that was covered. But the likelihood that you'll get as sick from the flu as if you hadn't gotten the vaccine is much lower. So it does help prevent those. It's the best that we can do to try to protect people. And one thing that I do try to share, just like what Christy was talking about, The reason you take some of these vaccines when we're kind of in that middle age range version is because we're protecting other people. RSV, we're lucky enough to have vaccine now to be able to protect those two age ranges. But the Tdap vaccine, we in the middle are carriers, and you don't even know you're carrying around pertussis. You're just someone that you're perfectly fine, but you have it on you. And if you go visit your young grandkids or your nieces, nephews, or you go visit your grandparents, you can carry that to them. And if you've never seen someone with whooping cough, you'll never forget it if you ever do. It's horrible, and it really can really take the little ones and the old ones down. It's very detrimental to them. So the best thing we can do is just prevent it from getting to them. They get the vaccine to protect themselves. We get the vaccine to protect them. And same with the flu. You will probably be okay when you catch the flu, but those little ones and those older ones, those medically fragile ones, they will not. And so we try to help them out by not spreading infection that way. Dr. Lazaro, did you want to add anything? I know last time you did.
Similar to what you shared, that sometimes people will say that they got the virus sickness even though they got the vaccine. Sometimes that happens because they only got the vaccine like maybe a few days, and usually our body takes about 2 weeks before they build up the antibodies for the virus. So that might be the cause of that. And sometimes also really the main goal really of these vaccines is to prevent severe complications that could lead to death. And so sometimes, as long as we really make sure that we want our vulnerable population to get it so that they don't die of these preventable illnesses.
Absolutely. So thank you. Thank you for that. Yeah, so vaccines, I just highly recommend, like Christy mentioned as well, the pneumonia vaccine is something that also changes periodically. It's not because the pneumonia vaccine is not useful. It's actually very useful. What's happening is they're finding new technology and new ways to package it and different ways to do it so that it's more effective. And that's why they say this one is due this year, but next year we're saying a little bit of a different one. That's why it's so beneficial to talk to your pharmacist. We are the experts in this kind of thing. We can really help figure out what you need. Your physician should as well, but most people will get their vaccines from the pharmacy. So talk to your pharmacist, see which ones you need, and just understand the reason sometimes these change is just because technology changed, or we're following where the different disease states and the different patterns go. So. Oh, well, look at that. That was the end. So, any questions or anything anybody wants to add to the conversation or anything? Sounds like not. Well, thank you guys for coming, and thank you for listening if you're listening to the recording. So I appreciate your guys' attendance. We'll be sending this kind of stuff out. If you have any questions, feel free to reach out to the University of the Pacific. I'll make sure you guys have our contact information. Dr. Lazaro, of course, will be available as well. And we'll have this available for you to refer to. But thank you so much for coming, and we appreciate you joining us for the series.